Doctors of Reddit, what is your worst case of I googled my symptoms? I had a grade school kid tell me he had a brain tumor. Turns out he put a dried bean in his ear and forgot about it. Actually, I'm a doctor, but this story is from medical school. I had a patient who correctly diagnosed herself with mastitis, although she was very worried that she had inflammatory carcinoma of the breasts. To be fair, they can look similar. Another time, I had a patient correctly diagnose a lump in her breast as a fibroadenoma. I was very impressed. If you are a breast surgeon with that username, my day is made. Serious answer, I try to ask my patients if they have googled their symptoms. It gives me a lot of information about what they are worried about. I then try to stay humble about their findings and try to not be a jerk about that. Trust is not built by telling people they are stupid. However, it is hard to keep a straight face when a 50-year-old male walks in and says I think I have caught the Down syndrome, or when a young woman thought she had testicular cancer. Paramedic student here. Last week we had a call for an imminent delivery. Part started having abdominal pain that would last a little bit and stop, and about 2 to 3 minutes later would start again. She googled her symptoms and everything she found was saying she was in labor. She called her husband, and he told her to call 911. We walked in as the baby was crowning. She had no idea she was pregnant. How do you not know you're pregnant? She stated she had still been having mostly regular periods, didn't notice any other changes, and she didn't look pregnant at all. My cousin had a baby and didn't know she was pregnant. She went to the doctor one afternoon for severe back pain and cramping, and even that doctor missed it. Said it was a kidney infection. We were texting that night, 6 years later next month, and I still have a screenshot saved on my computer of that conversation, and she tells me things like TMI, but I have gas bad enough I can see my stomach moving. She thought some pains she was having were gas pains, and I hurt so much I feel like my pelvis is splitting in two, and I'm never having kids. If labor is anything like this, she said if she didn't feel better by morning, she was going to the ER. Next day comes, and I don't hear anything from her. Finally around 10 that night she texts me, all I don't know if you've been an FB in the last 10 minutes or so, but I posted some pics. I had a baby a few hours ago. He was 30 weeks when he was born, and she wasn't a big girl, but not exactly small, but she wasn't showing. He was born butt first, and the doctor said he'd been laying sideways all the way at the back of the uterus. For such an early preemie, he did remarkably well. He was in neonatal intensive care unit for about 3 to 4 weeks. I think I'm stretching it, before he came home, and as far as I know, has no lasting effects of being born so early like some do. He's a happy, healthy, silly, energetic almost 6-year-old now. Not a doctor, but when my fiance said he was having chest pains, and when he breathed, it crackled, I googled and all of the symptoms lead to serious illnesses such as a collapsed lung. Thought nothing of it, diagnosed it ourselves as an allergy and didn't go to a doctor till later in the day. It was in fact a fully deflated collapsed lung. I had a similar experience several years ago. Woke up with a sharp pain in my back, couldn't stretch it out. Boyfriend tried to do the pick you up / shake / pop it thing for me, no improvement. Went to class, was feeling pretty run down and tired. In the middle of an exam my professor comes over and tells me I look really pale and unwell, and that I should go to the campus clinic. I didn't think I felt that bad, still figured I was just coming down with something, and my back was unrelated. Experienced some shortness of breath and lightheadedness on the way to the clinic. Nurse there freaked out upon listening to my lungs and was like, you need to call someone to drive you to his hospital. I'm calling the ER now, so they can hopefully take you back right away. I arrived there and was taken straight to imaging before even seeing a physician. Discovered lifting my arms above my head was sheer torture, and sobbed my way through the x-rays. Collapsed lung, full of fluid, no other symptoms, walking pneumonia. Very surreal because up until then I just felt a little tired and my back hurt. Not a doctor, but worked at a hospital for a while. One of our doctors came back to the nurses station laughing because someone was fully convinced they were diabetic because they were craving water, and Webb said that makes them diabetic. Turns out they are just human and require it to live. People are funny. Just last week a lady came in with shoulder pain. After examining her and comforting her, she told me that she was afraid it was cancer since she had been googling shoulder pain. Man. WTF Google. Not a doctor, but I deal with migraines. I would not be surprised if someone experienced a migraine for the first time, googled their symptoms while they still had the clarity to do so, and went to the ER thinking they are having a stroke. I had a stroke and thought it was a migraine, so this problem totally goes both ways. Not a doctor, but throughout my childhood and teen years I had these weird episodes where I would suddenly have really bad déjà vu and get very nauseous. For the next few hours afterward I would feel like I was in a fog and my memory would be shit. Eventually I googled my symptoms and learned they might be minor epileptic seizures. I went to a doctor and he laughed it off and told me it was probably just having panic attacks related to the normal emotions of being a teenager. I was so sure he was wrong that I opted to go get an EEG. Turns out I have a mild form of epilepsy and Google was totally right. Not a doctor, nor was my brother despite him thinking his Google foo is a degree, but a couple years ago my brother decided that, since I had been laid off and needed to borrow some money from him to tide me over, that it meant that I was utterly depressed and suicidal. Thus, he deduced that I needed to be institutionalized and took me to a doctor. He lied and said he wanted me to just get a normal checkup, since I hadn't had one in a while. I was, I believe, rightly pissed off and embarrassed, but since I needed the money I went along with it. So he decides to just come into the psychiatrist's office with me while she is trying to ask me some questions and see how I am. He starts throwing out terms like maladaptive coping and how I'm suicidal and needed treatment. She finally tells him to leave and I speak with her for a bit. Now I was a bit morose because I had lost my job and was embarrassed about asking for help, but I wasn't suicidal and the psychiatrist agreed, stating that I just needed support and not Google foo quackery. I hadn't turned to drugs, stealing or any other illegal or destruction activities to deal with my depression, just that I was a bit withdrawn and down because of my recent low. I went to a doctor one time and he googled my question in front of me. I've had the occasional doctor have to Google something in front of me before. I don't mind. They are not walking encyclopedias after all. I mean, I have an engineering doctorate and Google the simplest stuff on a daily basis. Knowing what to Google and how to interpret the results to make sure you come to the correct answer is what counts. Seriously, I'd much prefer a doctor who's willing to go how I'm not sure. Give me a secretary to check than one who goes all in your head. Next. Not a doctor, but I had a coworker come into the office with this one. He was having nausea, fatigue, frequent urination and decided to WebMD that shit. We're chatting in the office one day and he says something like, yeah, I've been feeling like shit lately and it sounds like gestational diabetes, but I can't find any cases of men getting it. I just slowly lowered my head into my hand and asked him, do you even know what gestational means? He did not. Ever since we studied multiple sclerosis and neuro, I'm convinced I have it, despite my only symptom being paresthesis, funny feels, in my legs at night. If your legs just feel weird at night and you have literally no other symptom, it's more likely just restless leg syndrome. It can feel like an ache or pins and needles, and makes you feel like you need to move, but moving doesn't actually help. Usually happens at night or early in the morning. It's pretty common. Not a doctor, but my friend once said a guy came with a backache and wanted to get operated cause he thought he had kidney failure. Not a doctor, but I was having horrible debilitating headaches for a while, googled my symptoms, and they ranged from stress to brain cancer. Ended up being sinusitis. I had that. I got horrible headaches and toothaches. I thought something was in my head like a cancer that was pushing on my brain and teeth. Turns out I had stress and vitamin D deficiency. I had two separate doctors tell me that I was having panic attacks, when in fact I was having simple partial seizures caused by a Lyme-sized cancerous tumor in my brain. I got so much Xanax though. You have 239 new messages waiting. If you enjoyed the video, please like and subscribe.